Action.
Hello, this is Shelby, and today I'm going to be discussing a patient with a T12 complete spinal cord injury. He is expected to have full preservation of his upper extremity muscles and partial of his trunk muscles, and we're going to be discussing the task of a wheelchair to mat transfer. So I will perform the transfer now. I'm going to place the feet and then adjust. So the problems that the patient was experiencing in the video was that he, in the preparation phase, he was not properly placing his feet in order to put weight on his tibias for the transfer. That was during the preparation phase. And then the second problem was low amplitude due to not really using his scapular depressors and elbow extensors during the execution phase. So overall, our treatment goals are for him to be able to properly place his feet every time before the transfer begins, and then increase his amplitude so the transfer occurs in one swift motion instead of like a choppy multiple scoots. We want one swift motion with standby assistance, and then like minimal adjustments can be made at the end. So the first intervention that we're going to do for placing the tibias is just to educate the patient. We're going to instruct him to place his feet not facing towards the direction that he is transferring, but more so like away. So we're going to face away like this. And then we'll progress that by actually weight bearing on his tibias. So we can do that by having him sit on the edge of the mat and just kind of rocking forward and basically just building his confidence, putting weight on his tibias so he can do that during the transfer. We would regress this intervention if he started becoming increasingly timid or started kind of throwing his body weight in an unsafe way. And then the second intervention that we're going to do is strengthening his scapular depressors and elbow extensors. We're going to do this by just doing some mat exercises by pushing up just like that. And we're going to progress the intervention by actually performing the transfer because practice makes perfect. And we'll just keep practicing performing the transfer so we can gain that amplitude. And then we would regress if any signs of overwork or overuse are occurring, because we don't want to like cause injury to his shoulder joints or anything, so we don't want to overwork him. And that is my transfer.